In the summer of 1976, the United States was celebrating its bicentennial. Across the country, parades filled the streets, flags hung from buildings, and millions gathered to mark 200 years of independence. In Philadelphia, one of those gatherings brought together members of the American Legion, mostly older veterans, meeting for their annual convention in the heart of the city. It was meant to be routine. It became historic. Within days, Philadelphia hospitals were admitting patients with severe pneumonia. These were not mild infections. High fevers, shortness of breath, rapid deterioration. Doctors were alarmed. The patients shared no obvious risk factors, except one: they had all attended, stayed at, or passed through the same hotel during the convention. At first, no one panicked. Pneumonia was common. But this didn't behave like ordinary pneumonia. Standard treatments weren't working. The illness progressed quickly, and the number of cases kept rising. By the time officials realized something unusual was happening, dozens were hospitalized. And then, people began to die. Within days, 29 people were dead. There was no poison detected, no known virus identified, no clear cause, and that uncertainty was the most dangerous part. Because in 1976, in the middle of a national celebration, the idea that a mysterious outbreak could appear without explanation raised immediate fears: terrorism, chemical exposure, deliberate poisoning. Public health officials were under enormous pressure to find answers. Early theories focused on food poisoning. Large gatherings meant shared meals, but food samples tested negative. Next came influenza. The symptoms seemed similar, but laboratory tests ruled it out. What about person-to-person spread? That didn't fit either. Family members and healthcare workers were not getting sick at expected rates. Every familiar explanation failed. As the death toll rose, the CDC launched one of the most intense outbreak investigations in U.S. history. CDC epidemiologists arrived in Philadelphia and began reconstructing the event, minute by minute. Who arrived when? Who stayed where? Which rooms? Which floors? Which common spaces? They interviewed patients, families, hotel staff. They mapped timelines by hand. They compared cases to people who attended the convention but never became ill. Nothing lined up cleanly. Environmental samples were taken: air, water, surfaces. Laboratories ran test after test. Weeks passed, then months. Still no answer. The tools available in the 1970s were limited. There was no rapid genetic sequencing, no PCR testing. Everything depended on culture techniques and visual identification. If an organism couldn't be grown using known methods, it might as well have been invisible, and that was exactly the problem. By late 1976, the investigation had stalled. The outbreak was real. The deaths were undeniable, but the cause remained unknown. That failure carried consequences. Without knowing the source, officials couldn't issue meaningful guidance. They couldn't say who was at risk. They couldn't say how to prevent it from happening again. The idea that a modern city in a modern country could experience a deadly outbreak with no explanation was deeply unsettling. Then, quietly, something changed. At the CDC, microbiologist Dr. Joseph McDade revisited preserved tissue samples taken from patients who had died months earlier. This time, he used innovative methods, approaches outside the routine techniques that had failed before. He adjusted culture conditions. He applied alternative staining techniques. Under the microscope, something appeared. Faint, previously invisible. A bacterium unlike anything identified before. Further testing confirmed it. It was a new species of bacteria. In January 1977, the mystery finally had a name: Legionella pneumophila. The organism thrived in warm water systems, places no one had seriously considered during the early investigation. Cooling towers, air conditioning systems, plumbing infrastructure. It spread not through direct contact between people, but through aerosolized water droplets, tiny particles released into the air and inhaled deep into the lungs. People weren't infecting each other. Buildings were. The discovery transformed the understanding of the outbreak and public health itself. Suddenly, the focus shifted from individual behavior to environmental design, from people to infrastructure. Hospitals, hotels, and large buildings were recognized as potential sources of disease. Cooling towers were no longer just mechanical systems. They were public health risks. New regulations followed. Surveillance systems were created. A new disease category entered medical textbooks: Legionnaires' disease. And while outbreaks still occur today, they are investigated with tools and knowledge born directly from that moment. The lesson of 1976 wasn't just about a bacterium. It was about humility. Science didn't fail because it lacked intelligence. It struggled because it relied on assumptions that no longer fit the evidence. The breakthrough came not from faster testing, but from looking again, from questioning what had already been ruled out, from refusing to accept no answer as the final answer. That is how science actually advances, not in sudden flashes of genius, but through persistence, skepticism, and the willingness to revisit the past. Sometimes the evidence was always there. We just weren't ready to see it. Follow for more real investigations that changed public health. This video is provided for educational and informational purposes only. It is intended to present a historical and scientific overview of the 1976 Legionnaires' disease outbreak and the subsequent discovery of Legionella pneumophila based on publicly available scientific literature and governmental sources. This content does not constitute medical advice, diagnosis, treatment recommendations, or individualized health guidance. Nothing in this video should be interpreted as a substitute for professional medical evaluation, diagnosis, or care by a licensed healthcare provider. The discussion of illness, symptoms, transmission mechanisms, and public health investigations is presented in a general, educational context and does not address individual risk, clinical decision-making, or current treatment protocols. Viewers should not use this information to make personal health decisions. If you are experiencing symptoms such as fever, cough, shortness of breath, or other concerning health issues, you should seek evaluation from a qualified healthcare professional or local health authority. All figures, reenactments, environments, and visual elements shown in this video are AI-generated or illustrative in nature and are used solely for educational visualization. They do not represent real patients, real individuals, or actual footage from the 1976 outbreak, and should not be interpreted as such. Every effort has been made to ensure factual accuracy using reputable sources. However, scientific understanding and public health guidance may evolve over time. Viewers are encouraged to consult primary sources such as the Centers for Disease Control and Prevention, CDC, the World Health Organization, WHO, and peer-reviewed medical literature for the most current information. The creator makes no claims regarding prevention, treatment efficacy, or health outcomes, and assumes no liability for how the information in this video is used or interpreted.